Cool, so we've got Joe Bloggs, who's a 65-year-old male who's presenting with chest pain. So what are some of the differentials and red flags we need to rule out?
So myocardial infarction.
Pneumothorax.
Yep.
A pulmonary embolism.
Cool.
Aortic dissection.
Yep, cool. Alright, so we'll keep those in mind when we're doing our stuff. I'm just going to allocate some roles now as well. So I'll be at the head of the bed, overseeing everything. We'll get Andrea as the MD1 to take a chest pain history, if that's okay.
Yep.
Just do the best you can. As Alex, are you okay with airways and breathing?
Sure.
We'll just assess the airway and a bit of a respiratory exam as well. Nathan, are you okay with circulation?
Yeah, and fluids as well.
Yeah, and fluids, so just a fluid status and blood pressure and a cardio exam. And Dave, I'll get you on procedures,
Sure.
so just looking at investigations, getting access, and those sort of things.
Yep.
Are we all good?
Yep.
Great,
Yep.
so let's start. Great, Andrea, can I get you to start assessing response and taking a history?
Sure.
Cool.
Mr. Bloggs, can you hear me?
Yeah, I can hear you.
Okay, Mr. Bloggs, I'm with the emergency team looking after you. I'm just going to ask you a few questions, is that okay?
Yeah, that's fine.
Okay, can you tell me what's been going on?
I just had some chest pain.
Okay, can you describe the chest pain for me?
Yeah, it's like right in the middle of my chest, and it's kind of like really, feels like it's crushing me, you know?
Okay, so a crushing pain in the middle of your chest. Is
Yeah.
it going anywhere else?
Yeah, it's going in my left arm.
Okay, in your jaw and your neck?
No,
Okay, and how would you rate it out of 10?
it's pretty bad, like 7 or 8 out of 10, I reckon.
Okay, and when did it first start?
It started this morning, and yeah, basically it just hasn't stopped since then. It just came on like bad at me, really.
Okay, what were you doing at the time?
Nothing, I was just sitting on the couch at home.
Alright, is anything making it worse?
Anything I do when I exercise, walk around, that all hurts.
Okay, and have you tried anything to make it better?
No, I didn't really know what to try. I called the ambulance straight away.
Okay, and apart from the pain, have you been feeling anything else out of the ordinary?
Yeah, I felt a bit nauseous and also a bit dizzy as well.
Okay,
Oh,
alright. Now, do you have any allergies to anything?
No, I don't have any allergies.
Okay, are you on any medications?
Yeah, some blood pressure and some cholesterol ones.
Okay, and you take those every day?
Yeah,
Alright. Have you got any other medical conditions that we should know about?
I don't think so, no.
Alright, have you ever been to hospital for a surgery?
No.
Okay. And when did you last eat?
This morning I ate breakfast.
Alright, okay. Thank you very much for that. We're going to try and figure out what's going on.
Okay, thanks.
Great, so while Andrea is taking the history, can I get Alex and Nathan to start assessing vitals and doing their examinations?
Sure.
Yeah, thanks.
Okay, Mr. Bloggs, I'm just going to get you to open your mouth.
Yeah, sure.
Okay, airways patent. Just going to put a blood pressure cuff on. Just blood pressure.
So the blood pressure is 100 on 60.
And I'm putting on a SATS probe now. What is oxygen saturation?
Saturation's at 88% in room air.
Just checking his pulse. What's the pulse rate?
Pulse is 130 in regular.
And capillary refill and tissue turgor.
Capillary refill's 3 seconds. Tissue turgor's a bit sluggish.
And with his respiratory rate, what is it?
Respiratory rate's 22.
Okay. Just going to listen to his heart sounds. Are there any added sounds or murmurs?
No, so heart sounds are dual nil murmurs heard.
Okay. And auscultating the lungs, is it equal air entry or any added sounds?
So equal air entry both sides, nil added sounds.
Great. Alright, I'm going to check his mucous membranes and assess his JVP.
Okay, so mucous membrane's a bit dry, JVP not raised.
I'm going to check your legs, Mr. Bloggs. I'm assessing for any peripheral edema.
No, so no peripheral edema that you can see.
So I'm just going to call for a 5 for 5 now. So can I get everyone so far to summarise their findings to the group? So Andrea, what did you find on history?
Yep, so Mr. Bloggs described a severe central crushing chest pain that radiates into his left arm. He first noticed it this morning at rest. It's aggravated by exertion. In terms of his medications, he's on tablets for blood pressure and cholesterol and has no allergies to anything.
Okay, great. And in terms of examination findings and vitals, what did you guys find? So with airways and breathing?
Yeah, so his airways patent, his oxygen stats at 88% on room air. He's got a mild tachypnea with a respirator 22. His lungs were clear to auscultation.
Okay, and in terms of circulation?
His blood pressure was low at 100 over 60. He was tachycardic with 130 beats per minute and regular. And in terms of fluid status, he was a bit dry.
Okay, alright. So with all of those findings, what do we think's going on at the moment?
His history sounds a bit like an ischemic type chest pain, so
Yeah.
myocardial infarction.
Okay, so I think MI's our number one at the moment. In terms of those examination findings, do we want to initiate any sort of immediate management at the moment?
Yeah, so given his oxygen stats, I'd like to administer some oxygen.
Okay.
I think
Sorry, go ahead.
I think you also probably need some fluids as well.
Yeah, great. So Alex, can you get onto the oxygen now? And in terms of fluids, Dave, can you start organising those?
Yeah.
And maybe given we think it's an MI and ECG as well.
Okay, I'd like to request IV access with a 14 gauge cannula in the antecubital fossa.
Yep, sure, there's IV access in the left arm.
Thank you. And I'd also like to give him 250ml bolus of normal saline and then reassess.
Yep, sure, that's running.
Perfect. Now, I'd like to request an ECG.
Yep, sure. Here's a recent ECG that was done in the ward.
Thank you. So the rate's 130. This is sinus tachycardia, and there is some ST elevation in the anterior leads. So I'd be concerned about a STEMI in the LAD.
Okay, so given that we've got a STEMI in the anterior leads, where to from here, guys?
Is there anyone you'd like to call at this point, or any sort of initial management you'd like to initiate?
Yeah, true. So I think we should get the cardio reg involved and perhaps get the cath lab ready, given that he's having a STEMI. So I'd like to request a code AMI.
Sure, the code's been called.
Great. And in terms of immediate management at this stage, is there anything you guys would like to initiate?
Oh, well, he looks like he's in a bit of pain. Can you give him something for that? Maybe some morphine?
Yep, great. So I'll get Dave to start initiating some morphine. Anything else?
I think oxygen's good, but that's already on.
Yep, great. And is that at 15 litres?
Yes.
Awesome. And any...
I think you could do with some GTN and some aspirin as well.
Yeah, okay. So Dave, can I get you to start doing, administering those medications?
Yeah.
Any other immediate investigations we need to run off while this is happening?
Well, I think you could use the CK and troponin as well as some basic bloods.
Yeah, awesome. So we'll request those as well.
Yep.